But how do we turn a patient? What direction do we go? Where should we be? Do we turn a patient toward us or away from us? And that's what I'm going to talk to you about now. And you should always, the way you remember this is you should always remain behind the patient's behind. So you should always be behind the patient after the turn. Now, the reason for this, if you turn a patient onto their side, most of their body weight is along their back and through their hips. Now, gravity being what it is, gravity is going to try to pull that patient back onto their back because that's what gravity does. It pulls things toward the center of the earth. So when you turn a patient over onto their side, gravity is always going to try to flip them back onto their back. That's just how it works. Well, if you are in front of the patient, so if you've turned the patient towards you, that means that most of their body weight is way on the other side of the bed, way far away from you. And if they start to roll in that direction, there's nothing you can really do to stop it because you're in the wrong place. You are on the other side of the bed from where they're rolling. So the chances are the patient's going to roll onto their back and possibly off the bed if you didn't scoot them first. So when you're turning a patient, you should never be in front of them after the turn. Now, there's another reason why you should not be in front of the patient. Number one is body mechanics, yes. Number two, however, probably more important. When you turn a patient toward you, okay, you've rolled a patient onto their side and they're facing you, you have put their face at crotch level. Now, that is not a comfortable position for a patient. Remember, that patient is already dependent, right? And dependent people tend to be taken advantage of and abused. So when you turn that patient toward you and their face is right in line with your crotch, that can be taken as a form of sexual harassment, you know, because you're putting them in a very uncomfortable position. So it's always best if you remain behind the patient's behind. You want to be careful of where your body parts are in relation to the patient, just so that the patient doesn't get uncomfortable, that weird creeped out feeling. Okay, so when you're turning a patient, always remain behind them. So page 91 has some good graphics there that shows you what happens when you turn a patient toward you instead of away from you, and better body mechanics when they're turned away from you. So page 91 will show you all of that.